So we've been getting a lot of questions recently about these great weight loss drugs on the market. And so I wanted to give a little bit of insight from a healthcare provider standpoint of what these are and how we can use them. So what is it? So semaglutide or semaglutide, however you'd like to say it, tirzepatide are the generic names. You may know them as Ozempic, Wegovy, Mounjaro. They have been around for quite a while. Mounjaro just came out recently, but there's been forms of semaglutide around for well over a decade. So what these meds are is they're actually diabetes drugs that have a really great side effect of weight loss. And so how do these work? Well, they work really in three ways. One is they work in your liver. It has to do with gluconeogenesis to get your blood sugars where they need to go. But it only actually does that if your blood sugars are high. And this is why people who are not diabetic can actually take these meds and not bottom out their blood sugars. The other way it works is that it slows down gastric emptying. So it makes you get fuller faster and you stay fuller longer. And the third way it works is in the satiety center of your head so that food just isn't quite as attractive. So what does that look like when you take these meds? And what it looks like is that you used to be always in the clean plate club and now you eat half your dinner. And that's because you get fuller faster. And if you push past those fullness cues, you will not feel well. So don't do it. But that satiety center is not giving you that feedback of, oh my gosh, this food is delicious, it's making me so happy. And so when you don't get that feedback, you eat your food because it nourishes your body, not because it's making you happy. And so what I tell patients is it gets rid of food noise. So for anybody who's struggled with their weight, you know that all day, every day, it's, oh my gosh, what am I gonna eat? Is it time to eat? Is it breakfast time? What should I eat? What should I not eat? And it gets overwhelming. And so what this med does is just kind of quiets it down, where you just don't think about it all the time. So what are the side effects? Well, if you dose it too high, too fast, or you just don't react well to it, nausea and constipation are two of the biggest side effects we see. I would say 80+% of my patients tolerate this completely fine, and they do really well on it. Other side effects, not a lot, honestly. Sometimes headaches, but I think that has to do with the blood sugars being a little bit on the lower end of normal. But we really don't see a ton of issues with it. So what are the realistic outcomes with this? So it's not gonna make you drop 10 pounds in a week. That's not good for you, honestly. What we expect is 1 to 3 pounds a week, but it makes it easier. It just makes it so you're not constantly obsessing about food. I've personally taken these on and off for several years and they work really, really well. It just makes life easier. But I will tell you that this isn't magic and that if you have untreated sleep apnea, your other hormones are totally off, it's not gonna work as well. So you've gotta make sure that you're working with a healthcare provider to get the optimal results of this. So I hope this gives you a little bit of information. If you have questions, please reach out to us. We do get these medications for patients not only through insurance, but also through some compounding pharmacies. So if you have issues, questions, concerns, let us know. We're here to help. Thanks for watching.